Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.
Welcome to St. Louis on the Air. I'm Sarah Fenske. St. Louis Mayor Lyda Krewson joins us today. As of Monday, the city of St. Louis will have been locked down for 7 weeks, but the doors are about to open. Mayor Krewson announced earlier this week that she plans to begin easing restrictions on May 18th. St. Louis County is doing the same, and Mayor Krewson is here today to help us understand why and what that might look like for us. So, Mayor Krewson, welcome to the show.
Thank you, Sarah. Appreciate being on with you and on with all of your listeners, of course.
So the Centers for Disease Control had said that cities and states could begin reopening if they see this downward trajectory in cases for 14 days. We're not there yet. What makes you think we're ready to reopen?
Well, you see, what's happening here is that since we have more testing, and you may know the city of St. Louis got 13,000 tests in this week. That was on an order that we placed at the end of March. Since we have more testing, we are seeing more cases. And so what the St. Louis Metropolitan Pandemic Task Force believes is that we really should be focusing on hospitalization, because that is the true of who is really seriously ill. And what we're seeing here is a significant downward trend in the number of people that are being hospitalized each day. Let's see, yesterday, maybe day before yesterday now, it was 34 people. The day before that, it was 29. And these are new admissions. And so that we are focusing on that and on the number of people that are currently hospitalized in the ICU and on ventilators to really tell us where we are in this, because we know that as we get more tests, we are going to have more positives. And it's not necessarily because more people have COVID-19, but we had such limited testing before that we were not finding the people or testing the people who had COVID-19.
Now we're getting a truer picture of who actually has it out there, and or maybe who has even had it and is recovering.
Well, that is true, although the tests that we're talking about are the diagnostic tests. The serology test, that's a different test that tells you whether or not you have had it. But, you know, the testing has just been, I'll just use the word, it's been such a debacle nationally, and we just didn't have enough. And we're beginning to get more tests. The city of St. Louis we had on order 220,000 tests. Right now, we've received 13,000 of them, and we sent all of those, about 3,000 apiece, to the federally qualified health centers who are doing the free testing in the testing sites that are both in North and South St. Louis. And we're expecting more tests now that things are easing up a little bit.
Are you worried that by reopening, however gradually we're going to do it, we could set off this much feared second wave?
Of course, I think we should all be worried about that. But I heard you say in the introduction that we're going to open the door. Let me revise that and say we're going to crack the door open. We are going to open it a little ways, 25-30% of the way open, so that we can ease into this. I think it's just extremely important that we open our restaurants, open our retail, but with restrictions, meaning, restaurants must have the tables 6 feet apart. Employees must wear face masks. And frankly, customers should wear face masks. If you are going out in public, outside your own backyard, it is unpredictable, in my view, as to whether or not you'll be able to maintain a 6-foot distance. Therefore, you should wear a mask. And it can be a cloth one, it can be a bandana, but you should wear a mask.
But you're also talking about that in terms of restaurants to begin, opening up through that crack there. How is it possible to wear a face mask if you're dining out?
Well, obviously you can't wear the mask while you're eating, but your server can be wearing a mask. And as you go in and out, you can be wearing a mask. And most likely, you will be dining with people that you are close to. Now, it may not be in your own household, but you're dining with a small group of people that you are close to. And if you have any symptoms, if you're sick at all, you don't belong in a restaurant. So I think what we all have to do is limit exposure. The other thing that I would say is that for individuals who are maybe over 65, it's a bit of an arbitrary age, or people who have high risk of illnesses, have underlying health conditions, they really should stay home as much as possible and avoid the social contact that would risk more exposure. And so what we see is that both the number of cases and the seriousness of cases is very tied to age. Now, of course, you can get COVID if you are a child or if you are in your teens or your 20s or your 30s. It's possible to get COVID. We know that. But we also know that most of the really serious cases are in older people or folks with underlying health conditions. So everybody needs to maintain a social distance, wash your hands a lot, until you're using hand lotion all day, every day, because your hands are raw. And we need to wear these face masks.
So you've got some restrictions you've mentioned here. These face masks are going to be strongly encouraged. You want employees wearing them if they're serving the public. The county has put down a very detailed list of what their rules are going to be going forward. Is the city ready to do that soon, or where do things stand with that?
We are. We actually, it's kind of interesting because we've been speaking with the county daily almost, and we thought that we were going to be issuing these at the same time, but I know, we all have our own pressures, and so the county executive went ahead and did his this morning at 8:30. But we are going to have very similar guidelines. They won't be exactly alike. One of the differences, for example, will be that right now, at least on Monday the 18th, large venues will not be able to open. And I'm thinking of places like the zoo, the aquarium, the art museum, the Arch. Those are large venues that exist in the city, and really the county doesn't have something that's similar. So that will be a difference. They are not going to open immediately, but what we are going to do is work with those large venues over the next few weeks to review their plans, because each of them is a little different and they'll have a little different plan, and then we will approve their plan before they begin to open. So there are some differences, but other than this large venue issue, which is not so much of an issue in the county, our orders are very similar.
Okay. Well, that should make things easier for those of us going back and forth between the two. Selfishly, I appreciate that.
Of course. I do too. Yes.
I want to encourage our listeners, if you have a question for Mayor Lyda Krewson, or if you want to share any concerns you have about our plan to reopen, you can join our conversation. Give us a call at 314-382-8255. That's 382-TALK. Or you can send us a tweet at STL on air, or email us at talk@stlpublicradio.org. Mayor Krewson, I have to ask you my selfish question, and that has to do with daycares and summer camps. A lot of parents are really anxious about those. What's your latest thinking on how you'll handle those in the city?
So we know that once people have to go back to work, that they certainly have to have daycare. And so we are going to be relying very heavily on the CDC guidance on daycare facilities, whether it's for little kids, that daycare, or whether it's summer camps. And the CDC guidance on those is really very good. And I would encourage all your listeners who have kids in child care to review those guidelines and to make sure that your child care provider is following those guidelines. Of course, we will make sure as well, but as parents, I know you want to do that for yourself, and so I would encourage that.
And will that allow, say, a daycare to reopen May 18th, as long as they're following these rules? They can open to children of non-essential workers, which is not allowed currently under the county rules.
That's correct. It's not allowed under the current city rules either. Although we had a little differences in essential and non-essential, but for the city right now, today, daycare is open only for police, fire, and healthcare workers, or so emergency service providers and healthcare workers. Of course, grocery store workers need childcare too right now. They have been working all along. And so I think social distancing in a daycare situation, depending on the age of the child, is difficult. But if you read the CDC guidelines, one of the things that struck me when I read them is that it says, well, so you should have a small group of kids, and that group should be consistent day to day. In other words, you don't want to switch it up with all the kids in the daycare. And so, that kind of rang true to me, just as one of the common sense things that a daycare center or child care center might do.
So if they're following rules like that and they're following the CDC guidelines, your thinking is that they can reopen as that door cracks open to people who need childcare beyond police and fire and who's currently allowed.
Yes, we are thinking that they can reopen. We expect, and we've spoken with them, we expect that they will have fewer kids, for a lot of reasons. One, not everybody's going to go back to work on the 18th. And that's why we're
for sure.
cracking this. And, we're still encouraging folks who work in offices who can to telework, telecommute, and, continue to work from home. So this is an easing of the restrictions. By the time we lift this, sturdy stay-at-home order, we will have been under the order for 8 weeks. That's a good long time, and you know what? It has worked. It has worked. We have tamped down the spread because of the goodwill of the people in this region. But on the other hand, we're already beginning to see, and you can hear about some of these, we're already beginning to see more violations than we saw a week or 2 weeks ago. And so what we have to do is allow some easing of these restrictions and put others in place, like wear a mask. We are going to require in our order that employees, public-facing employees who work with customers, wear a mask. We are not requiring customers to wear a mask, but I have to tell you, I think there'll be some peer pressure for people to do that. And certainly I know that is the case in situations that I have seen. So
will you allow?
I think that's going to be very important.
Will you allow businesses to refuse someone's service if that customer doesn't have a mask and the business wants them to be wearing one?
Yes, absolutely. That's a consistency with the county.
Okay.
So the business can do that. Now we know when you look at what is happening, really in Illinois. Someone sent me a couple of articles about this a few days ago. The non-maskers, I will call it, can be kind of, what would I say, edgy about it or aggressive about it. And so I would say don't confront those people, but I would also say avoid them, because sooner or later they're at higher risk than you are if you're wearing a mask.
Yeah, it's interesting how that's become almost a philosophical thing or a political statement where it's really so much more just simple common sense. But like everything, it becomes complicated.
For me, it's not political at all. It's just common sense. You don't want to get sick, and you don't want to get someone else sick. So just as sort of a good neighbor, a good person, you should wear a mask.
We're talking to St. Louis Mayor Lyda Krewson. I know we have so many people on the phone dying to get into this conversation. We do need to take a quick break, but the minute that we're back, which will be very shortly, we will take some of those calls. This is St. Louis on the Air on St. Louis Public Radio. That's 90.7 KWMU. And now back to our conversation with Mayor Lyda Krewson. Mayor, we have a lot of callers who have a lot of questions for you, so I'm going to dive right into that. Let's start with Helen. She's calling from St. Louis. Helen, hi, you're on St. Louis on the Air.
Hi, thank you for taking my call.
Yes, thank you for joining us. What is your question?
So I own 2 hair salons in St. Louis City in the Grove, Chop Shop and Chop Shop East. There's 17 of us who work there, and I have a question and a comment. The question is, when will reopening guidelines for salons be issued specifically? Will there be guidelines on steps for reopening? And then my comment really is just, I'd like the mayor to consider pushing us to the last phase of opening because of the nature of our job. It's high contact. We come in contact with 8 to 10 people a day. We're with them for 60 minutes, often at a minimum, in a very close space. So social distancing is impossible, and we are more than willing to be prepared to reopening with all the safety and sanitation measures, but it's pretty hard to access PPE, especially, to do it by the guidelines. To sanitize a space, we need disinfectant wipes, we need hand sanitizer, we need masks. So ordering these are often, maybe we'll get them in June. We don't know. I'm looking all over to find places that can get it delivered in a timely fashion, and there seems to be a shortage. It's also an added cost, and if forcing people between choosing putting food on their table or going back to work, it's just not really a great situation.
So, Helen, you'd like to see salons like your own stay closed longer. Mayor Krewson, how do you feel about that?
So, Helen, thank you for that. I have received, maybe 50 or 75 emails, text mails, Facebook, etc., from salon owners and hairstylists on both sides of this issue. In other words, many of them want to stay closed. Many of them want to go back to work. Just because you're allowed to reopen does not mean that you need to reopen. It does not mean that you're required to reopen. In fact, if you don't have the PPE, if you can't get the face masks, the gloves, the disinfectant, if you can't follow those, then you really can't reopen because you've got to follow the general business guidelines. So just because, same with restaurants, just because a restaurant can reopen on Monday the 18th, I know many restaurants that I've heard from are not going to reopen. They are going to wait. They don't know exactly how long, but a week, maybe 2 weeks to see how this goes. So just because you're allowed to does not mean that you need to. And so I think as a business owner, you have to make that decision. I know I've gotten emails from I don't know if it was you, but from someone at your shop, because I remember the distinctive name of Chop Shop. And so you don't have to open just because you'll be allowed to open.
Okay. Thank you for that answer. And Helen, thank you for that call. I know you guys are in such a tough spot right now, and it's great to hear your perspective. Kate is calling from St. Louis. Kate, hi, you're on St. Louis on the air.
Thanks so much for taking my call. Yeah, I think my question is kind of a follow-up there in terms of like what precautions we have in place. And I haven't heard, I'm very concerned that we're opening up without implementing both regular and repeated testing of both symptomatic and asymptomatic folks in the community, along with contact tracing. I saw the governor's recovery order saying that businesses should be prepared to participate and facilitate that. But along with the PPE question is how are people supposed to get PPE if PPE is not available? How are we supposed to facilitate contact tracing if there are no guidelines on that? Personally, I think contact tracing and regular repeated testing of symptomatic and asymptomatic folks is essential to really understanding how reopening is going to affect this.
Kate, I think that's a great point. Sure. And Mayor Krewson, some good questions there.
No, I think it's a great point, too. Kate, could I ask what business are you in?
I'm a clinical psychologist. So.
Oh, okay. All right. So there's several good points in your questions here. One, contact tracing. We have been doing that even before COVID-19. So contact tracing is a methodology where when someone tests positive for, in this case, COVID-19, but prior to COVID, it could have been tuberculosis or it could have been an STD. So when someone tests positive, that individual, along with sometimes their family, their employer, they put together the list and help the health department figure out who have you had a prolonged contact with. So closer than 6 feet, longer than 10 minutes is considered a prolonged contact. And so the contact tracing will be done by the public health departments. But as an employer, if you have employees, you will work with the person who's positive and the other employees to say, who has been around Lyda or who has been around Kate? Did you have lunch together in the lunchroom last week? So that then those individuals who can be enrolled in the quarantine program where they would have to stay home for 14 days. In the city of St. Louis, they're given a thermometer, they're given instructions, they have an individual assigned to them, and twice a day they have to sign on either to their phone or their iPad or their computer, enter their temperature, answer questions about how they're feeling, where they've been, and if they don't do it, then the red flag pops up and we call them on the phone and we continue to follow up with them. So contact tracing is up to the public health department, but of course you need the assistance of the employer sometimes in order to figure out who have they been in contact with.
And your the city health department has the resources right now. They are doing that on all these identified cases?
Oh yes, absolutely. We've been doing it. We've contact traced thousands of people, and we have about, right now, I think we have about 100 or so people that are still on active monitoring. What happened at the beginning of this process, when people were all out and about, if you had a positive case, sometimes you might have as many as 20, 30, 40 contacts for that person. Now that we've been on the stay-at-home order, and most people are following that, the number of contacts that a positive person has been greatly reduced to maybe 2, maybe 5, sometimes more than that. But and then we follow up and monitor those people for the entire 14-day period of time. We actually, ours is, of course, it requires individuals, but it also requires a program, an app that we use called Qualtrics, and we had that before COVID hit, and we had it because of STDs, and we had it because of tuberculosis, which isn't real common, but it happens.
Interesting. Wow, the things we're all learning about public health. This is good for our education, if nothing else. Kate, thank you for that call. I want to go to Emily, who's calling from St. Louis. Emily, hi, you're on St. Louis on the Air.
Hi, this has nothing to do with my question, actually, but I want to piggyback on what Mayor Lyda Krewson was saying. First of all, thank you for doing what you did when no other county in Missouri was taking action. You took action right away. I appreciate that. I live with a 70-year-old mom. But my neighbor was diagnosed a month ago, and none of that happened. He was living with his 2 sons. None of his sons were contacted. None of them had an app that they had to follow. In fact, they went out and hung out with all their friends.
Emily,
so I don't know what Mayor Lyda Krewson was talking about, but
Emily, was that in the city of St. Louis, or was that in one of the counties?
63116.
Huh.
But my question is actually about unemployment. So I am under unemployment due to DUA. I'm an independent contractor. On May 18th, does that go away? Even though my jobs are typically to work at, festivals and events at zoos. What happens to those people with on DUA and anybody in Missouri on the 18th with unemployment?
Well, if you're called back to work, and if your workplace, now I'm a little bit out of my league here because this isn't my specialty, but if your employer calls you to come back to work and if they can follow the proper guidelines, then I believe you don't have the option of saying, I want to stay home instead and draw unemployment. But if your employer doesn't call you back to work because they're not reopening, maybe because they don't have PPE, or maybe just because they're not ready to reopen yet, then I believe you still have the ability to have unemployment. And I know that the unemployment, and this is an interesting one. Unemployment in the state of Missouri is around $300 a week normally, maybe $320. But then the federal government added $600 a week to that, so it's $900 or so a week. I don't know if that's consistent with what you know or not, but that's my understanding. And so there are people who really don't want to take the risk of going back to work when maybe going back to work doesn't pay them much more than being home and drawing unemployment. So I know that that's a bit of a struggle here for folks, but unemployment won't last very long.
Mm-hmm. And Emily had mentioned that she works some of these big festivals, events at the zoo. I know you're not letting the zoo go through that cracked open door yet, but Lauren asked by email, any predictions on the ability to host family gatherings or weddings this summer? Many vendors are impacted.
Many vendors are impacted, so no social gatherings of more than 10 people. That's recommendations to an individual. So that refers to don't have a big barbecue in your backyard or, whatever that's more than 10 people. That's part of the individual guidance. For businesses, meeting rooms, large venues, ballrooms, those will remain closed on May the 18th. And other large venues, as I mentioned earlier in the program, the zoo, the art museum, the Arch, those large venues are also going to remain closed on the 18th. Now, your question was broader. You said for this summer, and we're hoping that they don't have to stay closed all summer. We're hoping that we can crack the door open a little bit here on opening restaurants and retail and offices, and that we'll still be able to, through social distancing and through mask wearing, we'll still be able to tamp down the spread, and we won't have a big second spike. And if we can do that, then there'll be a point in time that we can open meeting rooms, ballrooms, larger venues with a lot of protocols and precautions in place. So I can't answer right now for the whole summer. We've only been at this 7 weeks, and you think about all the things that have changed just in that 7 weeks. So looking ahead, 60 or 90 days, we're going to have to, we have to be flexible, and we have to evolve this.
We had a question from Alan. He has a very specific suggestion he wants to see you enact. He says the county closed the parks, bad call, but reopened with one-way paths, which was a very good idea. Can you please make Forest Park one-way around the perimeter? Any thoughts on that?
Well, it's something we could think about. What we did in Forest Park instead was we closed some of the roads so that you'd have a big, wide 40, 50, however wide feet road to walk on or ride your bike on so that you were not close to one another. It's 6.2 miles around Forest Park. So if you got on the path and you wanted to turn around and go back home before 6.2 miles, I'm not sure exactly how you do that. If we said this is a one-way path, you've got to go all the way around the circle. So, when you start thinking about some of the practical aspects of that, what I've observed, and I admit I've not been in Forest Park as much as I want to be lately.
I'm sure you're pretty busy these days.
But my husband's he's in it every day. And what I've observed that people are pretty respectful of one another to move off the path, to walk out around someone. The other thing to think about when you're walking or running, of course, when you're exercising a lot, you do exhale a lot more, air, breath, germs, but you also are not around that person for much time, presumably. Presumably, you're just passing. So it's the prolonged exposure with the droplets that is really the serious consideration. So get on the roads that are closed. Go at various times of day. There are times that the park is not very crowded and other times when it's super crowded. So, some of this just kind of has to be adjusted by our behavior versus actual, regulation. I had a woman call in on one of my Facebook Lives and she said, the Chinooks at Loughborough Commons is so crowded at 5 o'clock. What are you going to do about it? I'm like, honey, you just have to go at a different time, So it's just a little bit of, give and take here, a little flexibility.
Yeah, and you know what? That is actually the perfect note to end on here. I know we have so many more callers who have so many more questions for you. Just seeing this little taste of what you must deal with all the time is making me appreciate the work you do, and it's also making me kind of exhausted. People have so many opinions on this right now, and it sounds like the big thing is we're going to have to wait and see, and we're going to have to try to accommodate each other. Any other thought you want to leave the people of St. Louis with here today?
Just thank you so much to all of you who are staying at home, who are trying to work from your own kitchen table with your kids on the other end doing their homework. But thank you also to all the workers, and there are many who are going to work every day. Our hospital workers, our grocery store workers, and our city employees, most of whom are going to work every day. Police, firefighters, trash truck drivers, water department, airport. I mean, those folks are all still working. Thank you all, because we all have a role to play in this. So thank you so much.
Well, Mayor Lyda Krewson, thank you. Thank you for joining us today.
Thank you.
This is St. Louis on the Air on St. Louis Public Radio. That's 90.7 KWMU.
Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.